I'm Amitabh Chak. I'm professor of medicine and oncology at University Hospital's Cleveland Medical Center, which is an affiliate of Case Western Reserve University in Cleveland, Ohio. One of the efforts in BetterNet is to develop genetic markers that can help with Barrett's screening and eventually also help with detecting early cancer. So we had done the lab work, wet work, and had identified methylated DNA markers that were able to detect Barrett's esophagus with a high degree of sensitivity and specificity. But we needed to translate that into a non-endoscopic test so that screening could be performed more easily in perhaps a primary care office-based setting. And to do that, we wanted to design a device that sampled the lower esophagus. The reason for that is we know that there are cells in the proximal esophagus in the mouth that can contaminate your sample and dilute your sample. So we wanted something comfortable that could sample the distal esophagus and protect the sample as it came out. What's special about this device? Well, the balloon inside that capsule has a proprietary texture, and that texture is designed to collect and maximize the sample cell collection from the distal esophagus. Furthermore, the balloon is designed to invert back into the capsule to protect the sample from contamination as it's withdrawn. The capsule itself is sized to be smaller than a vitamin pill or a gel cap so that it can be swallowed by most patients quite easily. The procedure is pretty simple. The capsule is swallowed. There are markers on the catheter that tell you when you've gotten to the stomach at about 45 centimeters. You inflate the balloon once it's down far enough. You pull back to feel the gastroesophageal junction, and then abrade a little bit of the distal esophagus. Collect your samples, reinvert the sample back into your capsule, and then withdraw the capsule, protecting your sample as it comes out. This is what the device looks like compared to capsule and performance of the device. And this is my research nurse for the first time performing a capsule study on any patient. Where are we currently? Well, why did we develop this? Well, all of us know that Barrett's is a well-known precursor of cancer, and we have at-risk criteria that we've identified for decades. Yet, endoscopic screening is done only in a minority of these patients. Reason being, there's poor acceptance of endoscopy, it's invasive, it's costly, and our strategies for detecting Barrett's are not working. 90% of cancers are occurring in previously undiagnosed Barrett's, and the 5-year survival for this disease really has not improved. So we've proposed an approach where we use a biomarker-based paradigm for non-endoscopic detection of Barrett's and cancer, and this consists of the non-endoscopic balloon device for targeted sampling EsoCheck, and then molecular screening biomarkers for detection we call EsoGuard. Why methylated DNA markers? Well, they're quantitative, and with next-gen sequencing, they can be made to be highly sensitive and specific. You can also automate it at relatively minimal cost, and methylated DNA markers are already used in FDA-approved diagnostics. The two markers that we tested, methylated Vimentin and methylated CCNA1, their performance is shown in our pilot study with the EsoGuard device on 36 controls and 56 cases. The area under the curve was 0.91 and 0.92 for individual markers. That study was published last year at the beginning in 2018 by Science Translational Medicine. As you can see, the specificity was over 90% and sensitivity was 90% for detecting Barrett's. This study was noticed by NCI and was reported and highlighted in its annual report to Congress and the President. Since then, it's been licensed and commercialized. Where does Lucid sit right now? Well, they're ready to begin a detection study in both United States and Europe by the end of this fourth quarter of this year. To do that, they want to enroll subjects for screening. These are patients who meet screening criteria, never had endoscopy, by using EsoCheck and EsoGuard. They'll follow the recommendations put out by ACG and AGA in terms of who should be screened for Barrett's, and then compare the diagnosis by EsoCheck and EsoGuard versus upper endoscopy and biopsy. Any physicians around who want to be site investigators, who do frequent primary care type Barrett screening, are invited to talk to Lucid and be in touch for this study. In addition to those studies for detection, they also plan to do a case control study which enriches for cases in the United States, also to commence in the fourth quarter of 2019 to replicate what we've already done. Again, cases will be patients with prior diagnosis of non-dysplastic Barrett's, low-grade, high-grade, or intramucosal cancer, and simply compare the diagnosis by the technology of EsoCheck and EsoGuard versus upper endoscopy and biopsy. And if you're a physician who's interested to be a site investigator in this study, again, contact Lucid and stay in touch. Things are moving fairly rapidly. Thanks for your attention, and thanks for listening and your interest.